Hey y'all, I told you I was doing this live shit, so it's on, it's popping. This is real content right now. Now, just to remind you, there are two other videos. This is about electrolytes. We talked about all of the needs that all of the things you have to remember for electrolytes. So what are we doing right now? Well, we're trying to take care of hyperkalemia. So if you look at this page, you know that's where you should be in your acid-base handout. If you do not have an acid-base handout, remember I am here every Tuesday for you to come shopping and pick up some handouts. Now, bring me some money, right? No, I'm just kidding. So anyway, you know where it is. You know where to go. You know how to come. You know how to get your stuff. So let's go. This is, again, video number 3. So for hyperkalemia, we want everyone to remember that this is going to kill the poor patient. And so we have to look at this guy. I told you before, he's got a lot of issues. He's very weak. If you look at your handout, you can barely pick up those weights. He's got that urinal. It's terrible. There's no PP in it at all. He's on telemetry, and no doubt he probably has peaked T waves. And then if you look at the actual handout itself, it tells you all the effects of the high potassium. Number 1, remember potassium controls muscles. So basically every muscle is going to be out of control. See the diarrhea? That's all about peristalsis. That's too much going on. Muscle twitching, brisk reflexes. You have your blood pressure that's going to be very low, and then you have your peak T waves. So, you know, you got it going on. All right. Now, so here we go. If we look at the board, the number 1 treatment that we're going to look at is going to be this insulin cocktail. That's what we call it, an insulin cocktail. So if you work in the emergency room, they're going to be reaching for an insulin cocktail to treat the patient. Keep in mind, once we figure out that that potassium is way out of whack, we should have gotten an EKG anyway. And if there is anything weird, some kind of dysrhythmia activity on that EKG, that has to do with our first nursing action. So watch this. Your first nursing action is to hydrate the patient. So you're going to need an 18 gauge angio. You're going to have to put that IV in that patient right away because hydration will make the potassium go back into the cell. Next to that has to do with the EKG. Come on up and watch this. The calcium gluconate is the medication that you need to give this patient. It's as needed, right? We got the big PRN on the end. It's as needed for a patient who has dysrhythmias related to the potassium. Now, next is a little complicated. It is IV push 10 units of regular insulin. You are pushing in the IV this insulin, literally pushing it. Now, of course, you already know you go slow. You know that the only thing you go fast with is adenosine. So you know that this is going to be over like 2 to 6 minutes of pushing, right? And then you see it says, number 3, IV push, 25 grams. Be careful, students. This is D50W over 5 minutes. Again, we're pushing things very slow. Not D5W, D50W, like straight up sugar Kool-Aid, okay? Sugar water. I don't know how many of you grew up poor, but we made sugar water when I was a kid. Put it in the freezer and thought it was a popsicle. Okay, now, you have loop diuretics. You better know what that is. That's your Lasix, your Bumex. It's not going to be a brand name. It's going to be furosemide. It's going to be bumetanide. You got to know those names. And why? Well, because you know that loop diuretics are potassium wasting. Now, your HCTZ is also potassium wasting. You know, your hydrochlorothiazide, HCTZ, right? You better know that shit, right? You know that that is also potassium wasting, but that is not what we're using. We're using furosemide or bumetanide. And again, these are in your packet. You need a little Kayexalate. And look at the word, Kayexalate. It's an enema. However, it is really on your test, any test you ever want to take, it's going to be called sodium polystyrene. That is hard. That's the generic name, sodium polystyrene. You have a handout for this. You'll be fine. Okay, so this Kayexalate is an enema. You might be thinking, well, isn't that what we should have just gave anyway? Why do we have to do all this other kind of crap? Well, actually, that is a good question, but because Kayexalate is the drug of choice for a high potassium, except for the fact that it's too slow. So if your patient's potassium's really high, 6 whatever and up, they're going to need an insulin cocktail. The Kayexalate is going to work well over a few days, but not fast enough for what you need it for. Okay? Now, last resorts, right? We may need actual dialysis. Remember, dialysis will get the K right off the body fast, and that may be something that we need. We might need sodium bicarb for the patient if they're in acidosis. And again, sodium bicarb. Come on in, get that on there, because just in case I can't really see it, sodium bicarb if acidosis. And lastly, the diet has to be a little bit lower in potassium, not dramatically, but a little bit lower. And also, we go ahead and do false precautions because we said this patient has no muscle movement at all. So they cannot do what? Dance! I had to get in here. You know, I had to get in here where I fit in here. Bye. I'm sorry. I don't know what it is.